The availability of AI to compare treatment options, side effects, costs, and logistics is fundamentally changing the patient experience and the dynamics of medical decision-making. Traditionally, patients relied almost entirely on their doctors to present treatment options and make recommendations. Information asymmetry was enormous. The doctor knew vastly more than the patient. Now, patients can ask AI to explain different approaches to treating their condition, list potential side effects of various medications, compare surgical versus non-surgical options, and provide information about recovery times and success rates. This access to information enables more informed decision-making and shifts the power dynamic toward greater patient autonomy. In theory, this is positive. Shared decision-making, where patients and doctors collaborate based on medical expertise and patient values, generally produces better outcomes and higher patient satisfaction than paternalistic models where doctors simply tell patients what to do. When patients understand their options, they can weigh factors like side effect profiles, treatment burdens, recovery times, and costs against their personal priorities and circumstances. Someone who values quality of life over longevity might choose less aggressive treatment after learning about the side effects of aggressive approaches. Someone with young children might prioritize faster recovery time over slightly better long-term outcomes. However, this information access creates new problems. Patients may develop mismatched expectations, arriving at appointments requesting specific tests or therapies they learned about through AI without understanding why those might not be appropriate for their situation. AI provides general information about treatments, but can't assess whether specific approaches are suitable for individual patients with unique medical histories, comorbidities, and circumstances. A patient might read that a particular medication is highly effective for their condition and insist on it, not understanding that their kidney function or drug interactions make it contraindicated for them specifically. There's also the problem of information quality and completeness. AI might present treatment options based on general medical literature without incorporating the most recent evidence, local practice patterns, insurance coverage realities, or availability of specialists. A patient might learn about a promising treatment that sounds perfect, only to discover it's not covered by their insurance, not available in their region, or only appropriate for a subset of patients that doesn't include them. This creates disappointment and frustration. The cost information AI provides is particularly problematic because healthcare costs vary wildly based on insurance status, specific plans, geographic location, and provider negotiation. AI can't typically access a patient's actual insurance details to provide accurate cost estimates. The burden on clinicians increases significantly. Instead of presenting options from scratch, doctors now often spend time correcting misinformation, explaining why AI-suggested treatments aren't appropriate, or addressing patient demands for specific interventions. This can make appointments longer and more contentious. Some doctors report that patients come in with printouts of AI conversations, demanding explanations for why the doctor's recommendations differ from what AI suggested. This creates an adversarial dynamic that undermines the patient-doctor relationship. For AI to genuinely improve treatment decision-making, several things need to happen. The technology should help present evidence-based, value-based options with realistic information about costs, but this information needs to be vetted for accuracy and appropriateness. Integration into clinical workflows is essential, instead of patients using AI independently and then bringing information to appointments. Imagine systems where doctors and patients use AI together during visits to explore options with the doctor providing real-time context and guidance. AI could generate preliminary comparison tables that doctors review and customize for the individual patient. This preserves AI's information organization capabilities while ensuring medical judgment and individual circumstances are properly incorporated. We also need better patient education about how to use health information critically, understanding the difference between general information about treatment options and recommendations tailored to individual circumstances.